So, our project, the Newcomer Engagement Initiative, was developed to better understand newcomers' experiences with accessing primary care in York Region and to unpack the barriers that they face when accessing care. The aim is that the learning from our engagement initiative will support the OHT and our partners to better understand how we can enhance existing programs and projects to better serve newcomers, as well as how to tailor future programs and projects to address newcomers' primary care needs. When you actually hear people's stories live in real time, for example, in the case of our newcomers, it really allows us to tailor programs to immediate community needs rather than just looking at general concepts in the literature or trends that we're seeing in the data. We're really able to focus on what the newcomers are telling us or what any patient or public population is telling us. And the reach of this project goes well beyond simply OHT programs. Our findings will be shared with our OHT partners who work to deliver a variety of healthcare services in the community. And lessons learned from our work will allow partner organizations to revisit their own programming to make them also more accessible and relevant for newcomers. Additionally, what we found was very interesting with the engagement work that we were doing is that the newcomers actually have an opportunity to learn from each other. So in our most recent focus groups, the participants were actually able to connect and network amongst themselves, sharing information about, for example, community WhatsApp groups where they could share content and resources. A couple of our patient partners were able to share GPs who are taking patients and who speak the language of the newcomers who attended our sessions. So generally connecting over their shared experiences really did seem to be a valuable point, and another way in which communicating lived experience was a value add to participants, not only to us as the OHT team. And so finally, I just want to reflect and say that we sincerely appreciate the funding provided by the Public Engagement and Health Policy Project, because truly without this funding, we would not have been able to implement the project at this point in time in the OHT's development. The resources just didn't exist. And so we appreciate you and we thank you very much.